So we're going to kind of segue into your professional life now, but I do still want to talk about your personal experience and kind of how that informs your decision making for your patients. But first, let's talk about the TESTIS program. Was that something that you started because of being a patient and survivor, or is that just a coincidence?
Yeah, total coincidence. I knew I was always interested in testicular cancer after fellowship because I thought it was it's a really interesting biology tumor. It's really high cure rates. It impacts young men, and it's the most common cancer in the active duty military population. And so that I was already gravitated to that. And then I really wanted to have kind of like a central point for all military and even VA, if they choose, to have kind of like a standardized pathway for survivorship, for research, for even treatment, to basically having a system where we could set patients up for success. And so I was lucky enough, kind of pitched it to my leaders in the hospital, and they were able to give me the funding and, hired thus far. We have 2 nurses and, we have a clinical database and some research protocols, and just kind of expanded this thing out involving medical oncology. So we have in-person appointments, and we also do virtual appointments. And I knew the military, unfortunately, patients are set up for failure, not by the military's fault, but just by the fact that it's the military. So people are getting deployed, people are being moved around to different bases, people's doctors are being moved around to different places. People get out of the military and kind of have to find a doctor. So I wanted to have some way where there's a centralized program that we could follow anybody. So wherever you go, we can still make sure you're getting up to date on your CT scans and your tumor markers. Or if your doctor leaves and you have to find a new doctor within that military hospital, that new doctor knows your care, knows what you're due next for, rather than just leaving it up to the devices of the patient remembering to call and getting their CT and their markers and their chest x-ray done. And then I also wanted to develop a system that would help patients when they get out of the military and go to the VA, that they have good continuity of care, that we could help them get their images loaded over to the system, get all their medical records loaded over to the system. And then we expanded out to the survivorship. So, placing an importance on behavioral health and fertility counseling and recommendations for multi-D, which is multidisciplinary clinic with medical oncology and infertility services, urology, pathology, radiology. So we have experts at Walter Reed, but if you're at a small hospital that may only have 1 or 2 urologists, that may not do a whole lot of testicular cancer, that don't have an oncology training at a place that has high volume testicular cancer, or pathologist doesn't see testicular cancer often, et cetera, they've got somebody to call. So that's kind of the impetus for the center. And then, about 2 years later, I'm also a patient of that center.